SisterLove is a 27-year-old women's sexual and reproductive justice organization with a big lens on HIV, AIDS, and other sexually transmitted infections. And, you know, essentially we exist because nothing existed when we were looking at the problems of women affected by HIV and AIDS in Atlanta, Georgia. And I think what was most important for us at the time was, at least in my own experience, my background was in reproductive health. I worked at a local women's health clinic. We were also one of the few nonprofit clinics that was also providing abortion services. So we were already working with women, especially women of color and low-income women who had different intersecting challenges and risks in their lives to their sexual and reproductive health. And so it just became a natural progression for me to get involved in HIV and AIDS. And then actually it became a next natural progression to start SisterLove, because even in that reproductive health and rights community, HIV was not a priority. AIDS was not on their agenda in terms of delivering healthcare services, prevention education, or even mobilizing around the activism that was necessary even then in the late 80s. One of the things that I put to why not is because of the same stigma that was attached to AIDS that allowed so many different groups, advocates, communities, health providers, was because homophobia was attached to the AIDS epidemic, especially in the earlier days. And so for an organization like where I worked, which was founded and run by, I'm going to just be frank, by white upper middle class feminists, women who weren't necessarily culturally connected to what all of the social issues and all of the really impending health challenges that AIDS was presenting for women at the time, it just wasn't on their radar. And I will also offer up that when you are providing abortions, you already have a heavy cross to bear, so to speak. And there also wasn't going to be a lot of public funding for HIV work or HIV prevention, especially during a time when we had policies and laws like the Mexico City rule, which doesn't allow, or the Hyde Amendment, which doesn't allow for any federal funding. No matter what services you're providing, if you're providing abortions, you're not eligible. So that was really the reason. And I think the other part was there was no place for the women living with HIV or diagnosed with AIDS to come together, to know that they're not alone, to organize, and as we have proven, to take the leadership necessary. Wow, funding is always a big and interesting question. Funding now, I'll use the example that funding now, if you are providing sexual and reproductive health services that include abortion services, public funding is still not available to you, especially in states that are attacking Planned Parenthoods, that are attacking community health centers, that may be providing services that, especially in states that are passing some of these laws that allow you to use your own faith or your own religion to discriminate or deny services. So in that regard, there are lots of challenges to funding if those are the combined services that you're trying to do. If you're very siloed, and you're focusing in on HIV care, service delivery, prevention, you're going to have access to funding. But the challenge for us in that is that women's lives are intersectional. And so the work that we need to do is intersectional. And so we are still consistently challenged, especially by public funding, to get what we need to do. Private funding, I think, despite the fact that there's a lot of HIV apathy, I think, there's also a lot of enthusiasm now because we actually have, I think, an end point that we can see, that there actually is an end to HIV in our sights. And that, I think, kind of rejuvenates and helps us redefine what the work needs to be in order to get there. So we're a lot more concrete, and we actually can create a timeline. And so many health economists have also been able to say, this is how much it's going to cost. So if you simply do what's necessary to invest in the work that needs to be done, we could actually end this in our lifetime.